Hello everyone and welcome back to the channel. My name is Ekene Precious, and in this video we shall be discussing about section 4 of the Mental Health Act 1983. So this is one of the emergency sections of the Mental Health Act and allows a person to be admitted to hospital when there is an urgent need for assessment, and waiting for a second doctor's recommendation would cause an undesirable delay. So whether you are a student nurse, a registered nurse, healthcare professional, or simply interested in the mental health law, this video will help you understand what section 4 is, when it can be used, and the legal safeguard that has been put in place to protect a patient's rights. So section 4 of the Mental Health Act 1983 is known as the emergency admission for assessment. It allows an individual to be detained in hospital for up to 72 hours for assessment if there is an urgent need for admission and it is not possible to obtain recommendations from 2 doctors without causing an undesirable delay. So in other words, section 4 exists in situation of urgent necessity where a patient clearly meets the criteria for detention under section 2, but there is simply not enough time to get the opinion of second medical recommendation, and waiting for this will create an undesirable delay and a risk to the patient. So in other words, the law allows the application to go ahead on the strength of just one medical recommendations. So the key point to remember is that section 4 is not intended to be used routinely. It should only be used when immediate action is required. Person to be detained under section 4 of the Mental Health Act, several conditions must be met. Firstly, the person must be suffering from a mental health disorder of a nature or degree that warrants detention in hospital for assessment. Secondly, the person needs to be detained in the interest of their own health or safety or for the protection of other people. Thirdly, there must be an urgent necessity for admission, and obtaining a second medical recommendation would involve an undesirable delay. An application for detention under section 4 can be made by the approved mental health professional, which is popularly known as the AMP. It can also be made by the nearest relative of the person. However, in practice, the AMP is usually the preferred person because they are specially trained to assess risks, also protect the patient's right, and also ensure the patient receive the best treatment that is possible at that particular time. Section 4 lasts for a maximum of 72 hours. So during this period, a second medical opinion should be sought or arranged. So if the second doctor assess the patient and at this point the doctor also agrees with the first doctor, section 4 should be changed to section 2. However, when the second opinion doctor assesses the patient and the doctor is not satisfied or does not agree with the first doctor, the patient, it means that the patient no longer meets the criteria for detention, and in this situation, the patient should be discharged of their section. So even when a patient is detained under section 4 of the Mental Health Act, they still have certain rights. Firstly, they have the right to be informed of why they are detained. They also have the right to receive information about their legal rights in a way that they understand. So they also have the right to have someone informed of their detention if they wish. They also have the right to receive care that respects their dignity and also protect their privacy and confidentiality. So when a patient is detained in the hospital under the Mental Health Act, especially under section 4 of the Mental Health Act, the nurse have several roles to play. Firstly, the nurse have a role to conduct ongoing risk assessment, monitor a patient's mental state and well-being, provide reassurance and therapeutic engagement. The nurse also works collaboratively with the multidisciplinary team in order to provide high-quality care for the patient. So when a patient is detained under the Mental Health Act, especially section 4 of the Mental Health Act, there are several paperwork that needs to be completed. So there is a form called A9 form. This needs to be completed if the application is being made by the nearest relative. So form A10 also needs to be completed if the application is made by the approved mental health professional, which is known as the AMP. Then form A11 needs to be completed by the detaining doctor. Then also there is a form called the H3 form. So part 1 of the H3 form also needs to be completed by the receiving nurse. Then if after a patient has been assessed by the second medical doctor and they agree that the patient needs to be put under section 2, then the nurse also needs to complete part 2 of the H3 form. So remember that detention under the Mental Health Act can be a distressing experience for patients and their family. So compassion, communication, and professionalism are essential nursing skills that are required during this process. Thank you for watching this very video. Kindly like, comment, and share. See you in the next video. Keep being outstanding in your area of practice. Thank you.